Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Matthew Finn, an interventional cardiologist at Terrebonne General Health System and Cardiovascular Institute of the South. We will discuss American Heart Month, specifically interventional coronary care and pulmonary embolism. Thank you for joining us, Dr. Finn. All right, well, let's get started. We have a big topic to cover, but first, tell us more about yourself and your role here.
Thanks. Yeah, thank you for having me. So I'm a local guy. I grew up in Destrehan, just down the road, went to high school in New Orleans, and then did my medical school at LSU before doing cardiology up north in New York, and now happy to be back home in Houma.
Yeah, it's cold up there in New York, right?
Yes, it is. I'm happy to be here where it's warmer.
I know. We're glad to have you back. All right, well, tell us, what is interventional cardiology?
So interventional cardiology is a field within cardiology where we do invasive procedures, usually under the X-ray camera, mostly done just via a needle stick. Some examples would be stent procedures or angioplasty, which you probably heard of.
Okay. And how do you spot the symptoms of cardiovascular disease?
So cardiovascular disease is a very broad field dealing with many different aspects of the circulatory system, the heart, the valves, etc. Most classically, we talk about coronary artery disease, which are blockages that happen in the arteries that sit on top of the heart and supply blood to the heart muscle. Those symptoms are usually chest pain or pressure, classically, in the center of chest, moving to the left arm, may be associated with sweating, shortness of breath, or pressure-like pain.
Okay, so if someone has that kind of pain, what should they do?
I should present to the hospital and seek care urgently.
Okay, and then what can they expect when they receive treatment?
So in the emergency department, they'll be greeted by the doctors there. They'll get their vital signs taken, and we'll usually get blood tests and EKG to determine the severity of the symptoms and do a further workup. They'll have a consultation with the cardiologist to decide the next steps.
Okay, so what are some actions to help prevent cardiovascular disease?
So prevention is a real passion, and it's one of the most important parts, because once we get to the interventional part where we're doing the procedure, we've already, in essence, have established the disease. So we want to prevent it before it starts. So healthy diet, healthy eating, exercise, and seeing your doctor for preventative care to find underlying problems early so they can be treated before they become more severe.
Okay, and that kind of doctor is like a primary care
physician? You see a primary care, but I also recommend seeing a cardiologist for a preventative screening at some point.
Okay, and what are some of the warning signs?
So for warning signs for cardiovascular disease is like we talked about, chest pain, shortness of breath. It may be, like we talked about before, very severe, or it may be more subtle, like just some shortness of breath or fatigue that may represent underlying blockages.
Okay, and what are some common conditions that you treat?
So I treat both vascular and coronary disease. So blockages in the heart, arteries, also in the arteries and veins. I also treat blood clots and pulmonary embolisms.
Okay, and what causes these things?
Well, since they're such a broad spectrum of disease, on the arterial side, it's usually atherosclerosis, which is cholesterol-based plaque. And the venous side, it's blood clots, which can occur for a variety of reasons.
Okay, so cholesterol, you have to watch.
That's right.
Your levels.
Yeah.
And what can you do to help prevent? I know some of it's inherited, but there's other things you can do as well.
Right. So healthy eating, which can be very hard in southern Louisiana, maintaining a diet rich in fruits and vegetables are what I recommend. But for many patients, sometimes it can be inherited, and then really a medication would be needed in that circumstance. So a discussion with your cardiologist or your primary care doctor as to whether or not a patient may need a cholesterol medicine is important to have, especially if you have a family history.
Yeah, and some of the procedures that you do, are they minimally invasive, or what types of treatment do you provide?
Interventional cardiologists mainly do things through just a needle stick over a wire, basically.
Okay.
So
in the cath lab?
in the cath lab under X-ray.
Okay. All right. Well, let's just close out with saying, what is the one most important thing or a couple of most important things you want everybody to know out there?
I think trying hard for prevention is really critical. Getting on top of these diseases early before they become a real problem is so important. So go out, meet with your doctor, your primary, or make an appointment with us over at CIS so we can do a cardiovascular screening to help prevent the disease before it starts.
Okay. Thank you so much for your
Thank you.
time today. We appreciate you joining us.
Thanks.
For more information about Terrebonne General Health System's cardiology program, please visit tghealthsystem.com. Thanks so much for joining us on To Your Health. I'm your host, Rhonda Alfred, and I'll see you right back here next week.